Hi everyone, and welcome back to my YouTube channel. My name is Priya Mistry and I'm a general dentist with a practice in beautiful Portland, Oregon. Here at our practice, we are dedicated to taking care of patients with TMJ disorders. Please check out my Instagram page if you haven't. I have the handle right here. On this page, I post when my videos upload and just little tips or tricks to help take care of your TMJ pain. Today's video is about ear-related concerns. So if you or someone you know suffers with ear-related concerns, it could be either an ear infection or it could be TMJ related. So getting checked out by an ENT is always a good first step to make sure that it's not an ear infection. So if an ENT rules that out, then it's most likely associated with a TMJ related problem. The complaints that we hear most often related to the ears are number one, stuffy ears. So patients will come in and they say, I feel like I've been on an airplane and I need to pop my ears, or they just feel really full or congested. Another thing that we hear commonly is vertigo or dizziness that comes and goes. And third, we hear ear pain, and this can be sharp lancing ear pains. I've had someone say it feels like I'm being stabbed in my ear or someone's taking an ice pick to it. So that does not sound very pleasant. I've also heard it described as more of a dull ache. So it's not that sharp stabbing pain, but even those with the dull ache can have moments of that sharp stabbing pain. So those are kind of the main things that we hear about with the ears. So I want to go through and explain each of them. Let's start with the stuffy ears, or the feeling that the ears are really full or congested. This is typically because of muscular dysfunction in the muscles that surround and support the eustachian tube. These muscles are called the tensor tympani and the levator villi palatini. Really fancy name for muscles that surround and support the eustachian tube. The eustachian tube, one of its functions is to actually equalize the air pressure between the middle ear and the outer ear by opening intermittently. If or when these muscles that surround and support that eustachian tube become dysfunctional, those muscles with the fancy names that I mentioned, it can then put pressure on that eustachian tube and it can cause it to just sort of dysfunction. And so then the ears start to feel full, they start to feel like you need to pop them, they start to feel congested, and that's typically what causes that feeling. So if we can get those muscles calmed down, we can get that feeling to go away. And typically we can do that pretty quickly. So let's move on to explaining vertigo. To explain the vertigo, I want to sort of refer to osteopathic principles. So osteopathic doctors are doctors that study hands-on manipulation, and they understand that the body functions as a whole. The jawbone, the mandible here, which is the lower part of the TMJ joint, literally is suspended in a sling of muscle, and because of that, it is highly responsive to postural changes. The temporal bones, which are the upper part of the jaw joints, literally house the semicircular canals, which are in charge of balance. So if this unit is dysfunctional, if the muscles are dysfunctional, if the joints are dysfunctional, it can lead to vertigo and dizziness. And lastly, we will go over causes of ear pain, that sharp lancing pain in the ear or the dull achiness in the ear that's not from an ear infection. So this is explained by two structures. One of these structures is the discomalleolar ligament. The discomalleolar ligament is an actual anatomical, a physical connection between the joint and the middle ear. So this ligament attaches to the articular disc, which is in the TMJ, inside the joint, and it goes from there to the middle ear. So if that ligament gets stretched or strained, if that disc becomes dislocated or there's muscle dysfunction and that ligament gets stretched or strained, we believe that that's what causes some of that lancing pain or even the dull pain within the ear. And then the other reason for that pain in the ear is referred pain from the troublemaker muscle, the lateral pterygoid muscle. So the lateral pterygoid muscle is one that I talk about a lot because it attaches to the disc itself within the joint, and it has fibers that run behind the eye and just kind of all over. And it can definitely refer pain into the ear as well. So all of this information will beg the question, how do we treat this? We treat this at our office with custom-made orthotics, manual therapy, and myofascial release. So we measure where the muscles are the most relaxed and where the joints are nice and aligned, and we build orthotics to that position. Along with that, we do our own manual therapy and we do myofascial release, and this works really, really well. And we can usually get rid of the stuffy ears, the vertigo, and the ear pain within 3 weeks. So we have a good success rate. Having said that, this pain can come back in times of stress. In times of stress, we all clench and grind our teeth more. Even if we're not really fully aware of it, we're probably doing it when we sleep at night. So it can come back and people will have flare-ups here and there, but it typically never goes back to how it originally was. So they're better than the baseline, and the flare-ups will occur over stressful periods, of which people have had many this year. It's been a bit of a stressful year. So my friends, I hope that clears up ear-related symptoms, because I see a lot of questions about that. I get a lot of questions about that. I'm part of this amazing Facebook TMJ support group where they're posting a lot of questions about ear-related concerns. So that encouraged me to make a video trying to explain all of those. So if you liked what you heard, if you learned something, please click like below, subscribe to my channel, do all the things. I'm trying to increase awareness about this condition so that we can all work together to help more people. So if you guys have any video requests, any comments, any questions, please comment below. I'm always happy to answer. Reach out to me. I'm here for you guys, and thank you.